Hello, and welcome to our continuing Pathways to Parenting Success series. I'm your moderator tonight. My name is Dr. Jan Hittleman. I'm a licensed psychologist and the director of Boulder Psychological Services. It's my pleasure to welcome you this evening for our panel on the impacts of medical marijuana. I first want to thank our partners, the Boulder Valley School District and the Boulder Valley Media Alliance and Channel 22 for making this show possible. And a note to our viewers, both here and at home, we would really like you to be involved in this conversation. If you're watching at home, you can submit your questions by going to boulderpsychologicalservices.com, click on the Submit Questions button, and your questions will come right to us. We'd love to have your participation, so please consider joining us and sending us your questions. And for our live audience, you have index cards that you can write some questions on, and then we will be asking our panel to answer them for you. We gave a lot of thought to this topic. It's a very controversial topic, and I just want to mention a few things before we start. The discussion that we're going to have tonight is not really going to focus on the legalization of marijuana. That is another discussion. And, we also want to acknowledge that that we believe that there are folks in the community who do benefit from medical marijuana for true medical conditions. And so we don't want the audience to think that we're discounting that. We certainly understand that that's the case. Our focus tonight, though, is really going to be specifically on the impacts of medical marijuana on our youth. And we have a fantastic panel of folks that work with youth and even a person who is a youth. And so we'll get a lot of really good perspectives tonight. So remember, join us, be part of the conversation, submit your questions, and we'll be able to ask our panelists to address them. What we will focus on tonight is the effects of marijuana on the developing teenage brain, what professionals who work with youth are seeing in the community, and national trends in terms of treatment for marijuana use. We'll start by hearing a little bit from each of our panelists, and then we'll open it up for question and answer. Let's get started. I'm going to introduce our first panelist, who is Dr. Leland Johnston. Dr. Johnston is a psychiatrist and psychoanalyst for children, adolescents, and adults. He has been in private practice since 1983, first in Seattle for 17 years, and now in Boulder for the past 12 years. He teaches at the Denver Institute for Psychoanalysis and is clinical faculty at the Department of Psychiatry, University of Colorado Health Sciences in Denver. It's my pleasure to introduce Dr. Lee Johnston.
Hello. Thank you, Jan. I'm going to be putting a lot of effort in trying to squeeze in information into 10 minutes that I have for preliminary comments. It may sound very didactic with a lot of medical jargon and attempt to squeeze in that information. First, to know marijuana is a very complex plant. 400 compounds, 60 cannabinoids. The primary psychoactive component of marijuana is THC, tetrahydrocannabinol. There's evidence that marijuana has been used in healing arts dating back to 2700 BC in China. The fact that we have used marijuana during that time has given us plenty of experience to know there are a lot of problems with it. To wit, we call it dope, and people get wasted. 1979, the Controlled Substance Act classified marijuana as having high abuse potential and no safe medical use. Now, the key word I'm keying on here is safe. The research on marijuana for medical purposes has been limited. It's lacking. There have been studies, but the studies themselves have been retrospective and have been compounded by the fact that there are elements of uncontrolled variables that have not been dealt with. Yet we're in this very peculiar situation of medical marijuana. I don't bring that up because I want to discuss medicalization of marijuana. I bring it up primarily to emphasize that the medicalization of marijuana has accentuated the perception that marijuana is benign. It's on the ballot in November now. The petition has been placed and successful that we'll be voting on whether to legalize marijuana in California on the ballot in November 2012. Whatever may be your vote, the harmful effects of marijuana are becoming realized as medical research, and that's very recent medical research, has expanded to document an understanding of the impact of marijuana consumption. First, to understand, marijuana that we use through the medical marijuana dispensaries has the potency that's 4 times what is potency that was in, say, 1970s street dope. Now, in the 1970s, you could always smoke enough marijuana to get just as stoned as you get in 2012. The problem is that marijuana does not clear the body quickly. And when you're using very high potency THC, it doesn't take but intermittent use to keep a marijuana level, THC level, high or elevated in a continuous fashion. This is the impact that I want to try to describe on our youth by one set of statistics. This data is from 2009, where we knew that the peak use of marijuana in 1996 actually declined for 12 years, so that in 2008 it was at a much lower level than it had ever been. At the time that medical marijuana came on board and was given sort of a veracity by all of the dispensaries, the perception of it being benign or not having harmful effect increased 10%. And it so happens in that following year, 2008, 2009, the percentage use of marijuana went up 10% in our adolescent population. Now, the current statistics from 2009 document that in the 12th grade, at that time, 1 in 20 were smoking marijuana daily. That figure is probably much higher. Linda's got quotes on figures here in Colorado that she'll go over. But I don't want to bomb you with statistics. I do want to emphasize 4 areas in which marijuana is extremely harmful to the human brain. Number 1, there have been 7 studies that document the increased risk of psychotic symptoms. Now, when I say psychotic symptoms, we're talking about paranoia, auditory hallucinations, visual hallucinations, delusions, thought broadcasting. These kinds of symptoms are documented that with increasing dosage, increasing duration of marijuana abuse in adolescence, the increase of psychotic risk is higher. One way of quoting this is to say that anybody, this is figures out of 3,800 cohort of adults that were tracked from birth in Australia and interviewed over a series of times, that if you started using marijuana before age 15, your risk of having psychotic symptoms was 2 times the risk of those that did not use. Now, the second area, mood disorders. In our own University of Colorado system of psychology, we've got data, epidemiological data, of looking at a 14-year study of 20,000 adolescents. And that retrospective view has documented and isolated that the lifetime prevalence rates of depression increase 15%. Let's go to auto accidents. The National Transportation Safety Board studied 182 fatal truck accidents in 1990. And contrary to what is public opinion or notice, perception, is that everyone thinks that alcohol is the culprit about substance abuse when it comes to traffic accidents. Well, in that data, marijuana was as equally responsible for fatalities in auto accidents. Now, I want to spend some time talking about executive function very quickly. Executive function is the area of the brain that's responsible for executing all of the cognitive processing that goes on in the brain. The executive function holds your attention while your brain works to remember, code memory, bring things out of memory, or to execute cognitive functions in general. The executive function extends throughout from the prefrontal cortex all the way out through the rest of the brain to accomplish the functions of organizing, prioritizing, planning, multitasking, sequencing information, modulating emotion, modulating activity level, for example, hyperactivity or impulsivity. We know that marijuana impairs executive function. It's obvious when anyone's acutely stoned, they cannot really execute. But the data has been there for a long time that it takes a while, even after being intoxicated with marijuana, to recover from even some mild marijuana abuse. The data I want to talk about, though, is the long-term impact of marijuana on executive function. And when talking about executive function symptoms, you can use the database that's there for ADHD, a kind of nomenclature that's been around since the 1950s, which are basically a listing of executive function symptoms. Pope, in 2003, documented that users of marijuana after the age of 17, that they used enough to have executive function symptoms, and then they stopped. They were sober at age 22. And the patient population he followed, after they stopped, they could recover the deficits. It took longer than would be common notion, sometimes take as much as 6 months to recover the deficits, but you could recover the deficits. Brooke, in 2008, documented that if you begin to use marijuana from age 14 to 22, and then developed executive function symptoms along the way, had impairments of executive function, stop at age 22, then you're tested again 5 years later, 5 years of sobriety at age 27, those that had used still had more deficits than those that did not use. Now, the amount of deficits depended on the amount of dosage and the duration. But what's really important about this finding is it documents that even after 5 years of sobriety, our youth were not recovering the full function of their brain. They had deficits that were permanent. Now, how is this happening? What's the mechanism in the brain? I'll speak briefly to this and pass it on to Linda. We know that marijuana makes dopamine receptors more reactive. We also know from neural imaging, for example, BOLA in 2005 and other imaging studies, that there's decreased size and development in the prefrontal cortex, and there's decreased size and development in the hippocampal cortex, which is another area of the brain. The current model that is being proposed in the Progress in Neurobiology in June of 2010 is a model that documents that there are cannabinoid receptors throughout the brain. Now, CB1 receptor is only one cannabinoid receptor. It's the receptor that THC hits. Now, CB1 as a receptor is very crucial to other receptor systems. I'll name them briefly: GABA receptor systems, glutamate receptor systems. There has to be a balance between those receptor systems in order for synaptic pathways to be laid down successfully in the brain. When THC hits a CB1 receptor, it causes there to be an imbalance in those receptor systems. And therefore, an imbalance causes a deficit in the way that the synaptic architecture is laid down, and this is particularly pertinent in adolescence, and I'll explain why. We have the most neurons at age 10. From age 10 through the rest of our life, we prune the brain so we lose 40% of those neurons. Most of that pruning happens in adolescence. When the pruning is happening, it's happening for developmental reason. The brain is trying to link up executive function pathways that will express the brain with efficiency so that the neurons that are going to be used are used very effectively. So at the time that there's pruning, there's also synaptic architecture being laid down. This is happening in adolescence in a way that happens with developmental growth that's just much more than any other point in time in life. So if you're affecting that CB1 receptor in adolescent development, you're affecting the capacity that the brain has to lay down those tracks. And that's why this is such a serious subject. We're causing deficits in the adolescent brain that can be permanent. I'll pass it on to Linda.
Thank you, Lee. Our next panelist is Linda Kane. Linda has over 25 years of experience working with struggling youth and young adults. As an educational and therapeutic consultant, she helps families identify and select appropriate resources such as schools, therapeutic options, or transitional living programs to ensure the student's success. She specializes in learning disabilities, emotional, behavioral, and mental health issues. It's my pleasure to welcome Linda Kane.
Thanks, Jan. I'm often asked the question, is medical marijuana the same thing as illegal or street marijuana? And I often hear parents comment to me, well, my kid doesn't do the street drug. He has a medical marijuana card. He or she's doing that. So one thing I would just like to clarify is that although medical marijuana is grown under controls, while street marijuana or illegally obtained marijuana is not or may not be, meaning that it might be, the illegal kind might be laced with pesticides or could contain other things. Both of them contain THC, which is the primary chemical that's responsible for the effects of this drug. So THC is entering the body, whether it's getting there through smoking it or eating it in a brownie that somebody baked. The influences of THC are the same. So I wanted to look briefly at how much marijuana use is going on in the population of our youth across the nation. So about 3 months ago, the National Institute of Drug Abuse released a report that involved over 46,000 high schoolers throughout the nation. And what it found was that while there had been a steady decline for years in alcohol and cigarette use, currently 1 out of every 15 high schools smokes weed nearly daily. And for 10th graders throughout the nation, smoking weed is more common now than smoking cigarettes. Narrowing it down to Colorado, first of all, an interesting statistic I ran across is that overall, so this would include all age ranges, Colorado's population ranks #1 in the country for weed use in the last 30 days. Our Department of Public Health and Environment recently stated that about 38.5% of the people in Colorado that are ages 12 to 25 have used marijuana in the past year. That statistic is actually 10% above the national average. Adams County recently conducted a survey of their 27,000 students. They did this in the fall of 2010. What it revealed was that nearly 30% of high schoolers, so kids grades 9 to 12, nearly 30% of them had used marijuana in the past month. What shocked them about this was when they went back and compared that statistic was up by 58% from 2 years earlier when they had done the same survey. That's not Boulder, though. So what about Boulder County? Well, our last youth risk behavior survey also revealed that nearly 30% of our high schoolers have used weed in the past 30 days. This statistic, this 30% of high schoolers having used weed in the past month, is 10% above the national average. So one is tempted to ask, has medical marijuana had an impact on Colorado's youth and their use of marijuana? Since the legalization of medical marijuana in Colorado, substance abuse treatment centers have noticed a steady increase in teens that are needing help for addiction. One Denver center recently reported that their adolescent population has tripled. 95% of that population are there specifically for marijuana abuse. A doctor at another center found that of 80 kids teenagers admitted for marijuana addiction, half of them said that they had received at least some of their marijuana they used from a medical marijuana license carrier. In another treatment center, of the teens there, of those who had smoked weed daily, 3/4 of them said that they had obtained their weed from a medical marijuana card holder. Okay, so we know that there are lots of kids in Colorado that are using weed. We know we're above the national statistic. Well, thinking that through, the job of kids, of teenagers, is to go to school. So does the weed have any effect on their schooling? As Lee was talking about, the hippocampus is the area of our brain that is responsible for organizing memory, storage. It helps control things such as verbal intelligence, judgment, decision-making, problem-solving, and motor coordination. But it's also the area of the brain that's most impacted by THC. So the neurons or cells in our hippocampus are actually quite close together, but they don't actually touch. So data moves from one cell to another through this gap, through either an electrical or a chemical process that we call synapse. But THC also creates synapse in the brain, and when it's doing this while the brain is doing its normal functioning of transferring data from cell to cell. So what happens is these conflicting signals create confusion to the cells. That in turn interferes with the normal brain function and the ability to learn. So when we see kids who are high in school trying to learn, they're more impulsive, less attentive, less motivated, slower to make decisions, more easily confused. They have less ability to problem solve. Their working memory is impaired. They give up much more easily trying something, and they're actually physically clumsy. In a nutshell, their perception, concentration, recall, coordination of facts, balance, and reaction time are all affected. One thing to bear in mind when you think about this is that research has shown that the effects of THC on synapse can last up to 15 months after someone stops using weed. Kind of aside from that, one of the populations that tends to be very high in weed use are kids that have ADHD. Sadly, it's often these kids that are using, it's their drug of choice, but they're already dealing and struggling with the things such as short-term memory, organization, and impulsivity. So this population is even more affected by using weed and the THC that it's ingesting. Okay, so besides the learning area, are there other areas related to schooling that THC impacts at all? Students who regularly smoke weed before the age of 18, I think, Lee, you were referring to this, can actually change the structure and functioning of their brain to a point where there's permanent cognitive deficits. It means that their level of normal functioning is actually lower now than it would have been if they hadn't been using. Weed has also been linked up to the risk of dropping out of school. A person who doesn't smoke before the age of 18 is 4 times as likely to graduate from high school as well as college than someone who starts smoking before the age of 15. So there's less learning ability, there's lower graduation rates. What else? Last year, Colorado school districts experienced increasing drug-related offenses. Disciplinary action was 25% higher. Out-of-school suspensions were 29% higher, and the expulsion rate for drug-related offenses grew by 25%. Lastly, I just want to highlight 3 things. And then I want to draw those 3 things together and leave you with a thought. So we know THC impacts performance, whether it's at school or at a job or even driving a car. That's the first thing. We know that THC increases the likelihood of risky behavior. And the third thing is that THC is fat soluble. That means that it's stored in fat cells. So it takes 3 days for someone's body to process out half the THC contained in the average marijuana cigarette or joint, and 30 days to get rid of the other half of that THC that's contained in one joint. So if you keep that point in mind, here's a thought to take with you. The adolescent who claims that they are smoking or does smoke as little as one joint a week, in reality, not only is never free from THC in their brain, but in actuality, they're accumulating and increasing the amount of THC that's in their brain.
Thank you, Linda. Our next panelist is Avani Dilger. Avani is a licensed professional counselor and certified addiction counselor specializing in substance abuse prevention and treatment with adults, teens, and families. She's also a member of the Motivational Interviewing Network of Trainers. Avani is the founder of the Natural Highs program, Natural Highs, Healthy Alternatives to Drugs and Alcohol, which is currently offered in several Boulder High schools and Naropa University. It's my pleasure to introduce Avani Dilger.
Thank you, Jen. So I thank you both so much for carrying and bringing so much data together, because I think the numbers are really impressive. And I thought I want to talk a little bit about my experience working over the last 10 years as a substance abuse counselor in Boulder, mostly with teens and mostly with teens who got in trouble with the law through their marijuana use. And one of the interesting aspects that I've been seeing over a long period of time is that people think that marijuana is kind of a harmless drug. A lot of people who use marijuana think that they're not addicted, feel that marijuana is not an addictive drug. And when we talk in schools with kids or when we talk with parents in parent meetings, people even still ask the question, well, is marijuana psychologically addictive or physiologically addictive? And people tell me all the time, well, I can stop anytime. So somebody would, smoke once in a while and they feel like, well, I don't have to smoke every day, so obviously I'm not addicted. The interesting situation, though, that happens is that when people have to stop, let's say they get in trouble with the law and then have to quit smoking marijuana, that suddenly at that point they realize that they can't stop. I have worked with people who were using a bunch of different substances, including so-called hard drugs like cocaine or crack cocaine or opiates, and they found that they could quit those hard drugs, but that they could not quit marijuana. So they were suddenly faced with the reality of noticing that marijuana is extremely addictive. That's probably not for everybody, but it's certainly for a lot of people that I have seen and that I have worked with. And so now that brings up the question, why do people think that marijuana is not addictive, and yet when they have to quit, that suddenly they're faced with feeling it's impossible to do that? And you both have mentioned already the mechanism that contributes to that, which is that there is no other drug that stays in the system for that amount of time. Typical drugs leave the body within hours or within 1 or 2 days. So when you look at heroin or cocaine or drugs like that, ecstasy, they leave the body very, very quickly. Marijuana stays in the body for up to a month. And because it is fat soluble, it is actually a slow release drug. So I compare it to people. For people, I say, so imagine you would snort a line of cocaine right now, and then for a month you would have little bursts of cocaine going off in your body all the time. That's a little bit how marijuana works. So if you smoke marijuana today, you will have little bursts of THC going off in your body for a very, very long time. Now, because of that, marijuana doesn't have a clear rebound effect. People have looked at substances, at drugs, and the moment a drug has withdrawal symptoms, such as alcohol has, or heroin has, or cocaine has, people say, well, see, this drug is addictive, because the moment the drug leaves the body, people feel really terrible and have strong cravings to do the drug again. Now, marijuana doesn't have that. And so people thought, well, marijuana doesn't have a serious withdrawal, so it must be not that serious of a drug. People don't notice that because of the slow release nature of THC in the body, that the rebound effect is not happening, it's covered up. And the real rebound effect of marijuana happens 4 weeks after the fact, after somebody has quit. So when I work with people who have to stop marijuana because they are on probation or in a legal situation, they find that it becomes very, very difficult after a lot of THC has left their body. And, most people don't even know what the rebound effect of marijuana is, because most people don't stay clean long enough to notice that. And so I want to mention what I've seen, what people struggle with when they quit as rebound effects. One of them is extremely low motivation or having no energy. The other one is pretty severe sleep disruption. Another one is pretty serious emotional issues such as anger, anxiety, irritability, and depression. And those effects are very, very difficult for people to manage. And because they're so delayed, they're up to 4 weeks delayed, people get that sense of like, wow, I've been staying clean now for 4 weeks. I don't like being sober. It feels terrible. And so it's a really, really big temptation to just go back to using marijuana. So because of this mechanism that people are usually not aware of, I have seen that marijuana is a more addictive drug for a lot of people than, drugs that we consider hard drugs. There's another mechanism about marijuana that I've seen be really devastating in the lives of young people, and that is that marijuana creates a shortcut in the brain, just like other drugs do, that marijuana manipulates dopamine systems in the brain, that really when you study dopamine is probably one of our best friends. Dopamine was given to us by nature a long time ago to help us do things that are difficult. When you look back into the hunter's time, dopamine was created in our system so that we would go out, that we would hunt down animals to eat, and that we would overcome all these challenges. And then at the end, finally, the brain rewarded us with dopamine. Now, the problem with marijuana and other drugs is that it tricks your brain into believing that you would get the reward. So now you don't have to get up from the couch and deal with really difficult challenges, but you can just smoke some marijuana and you're going to get that reward in your brain. So what happens is that in a young person's brain, this idea gets created that you don't have to do anything, you don't have to face challenges, and you can feel happy, you can feel rewarded, which is a very, very dangerous shortcut in the sense of like, then why should I ever, deal with challenges again if I can have that so easily? If you create that habit in a young brain, it's much, much harder to be motivated to actually deal with challenges. I think Michael Bradley, who is a psychologist and wrote beautiful books about, young people, I think he hit the nail on the head. He said the worst thing that marijuana does for young people is that it takes away the angst of young people, that it takes away anxiety from young people. And I have seen that absolutely, and I would totally second that. That, of course, if a drug feels so good and makes me feel so comfortable, it's very tempting to use it, especially at a time in my life when I have to deal with a lot of anxiety, like the question, what do I need to pursue in my life? What should I pursue after high school? All of those questions, those big existential questions, are really difficult, and they bring up a lot of challenging feelings. And in that time, it is not a good thing to manipulate those emotions, those feelings, because I think we have them to deal with very, very big questions in life. And so I think, in particular at that time in somebody's life, marijuana is not a good situation. It can really undermine this kind of emotional radar that we have to really find our path in life. I want to return to the question, is marijuana psychologically addictive or physiologically addictive? And I think both of you have made that very clear of how much of an impact physiological impact marijuana has. And I want to show you some pictures. And in the Natural Highs program that we do in high schools, those pictures, those images of brains affected by marijuana have influenced a lot of kids to reconsider their use of marijuana. And that's why I brought those images today for you to look at, especially if you're still wondering if marijuana is psychologically addictive or physiologically addictive. So these images that I'm going to show you, they are SPECT scans. So they are not showing brain tissue, but they're showing blood flow in the brain. So basically brain activity, which blood flow translates into. So here you see a brain that is clean and sober from the top, photographed from the top. And everything that lights up here is brain activity. So it's blood flow and shows that the brain is actually working and where the brain is actually active. The next picture is the same brain photographed from underneath. Okay, so again, a clean and sober brain of somebody who's not using any substances. Now, the next image that I'm going to show you is a brain of an 18-year-old who has used marijuana since the age of 15 and is using it 4 times a week. So not every day. And look at what's happening in the brain. So I'm sure you heard this interpretation when people say it makes holes in the brain. So that's not true, right? Obviously, you see here what looks as like holes in the brain are not holes in the brain. They are areas where the brain has no blood flow, where there's no activity. And when you look at this part of the brain here, this is the prefrontal cortex that both Lee and Linda have talked about. And you see that basically half of the prefrontal cortex is not working, where blood flow is not happening, activity is not happening. And that is not, in this particular brain, this is not a daily user. So this is somebody who uses 4 times a week. And you see that there's massive physiological changes that happen because of that. The next picture, just one more, is a 28-year-old who smokes marijuana mostly on the weekends only. So again, a person who doesn't use THC or marijuana every day, but uses it just on the weekends. And you can see the massive changes that that creates in the brain. So just to rethink that question, whether marijuana has physiological impacts on the brain or not. And I want to leave it at that.
Thank you, Ivani. I want to let our viewers and our audience members know that we're very fortunate in the city of Boulder to have the Natural Highs program. If you don't know about it, you want to find out about it, and I would suggest that you visit naturalhighs.us, which is the Natural Highs website. I also want to let you know that there's a great opportunity on March 21st to hear more from Ivani. She's going to be talking about research-based alternatives to risky behavior and tools for parents and youth. This is a free program, and it's going to be taking place at New Vista High School from 6:30 to 8:30 p.m., again on March 21st. And it would be a wonderful thing to go to. I'm assuming, Ivani, parents can go with their youth, right? What a wonderful opportunity to hear from Ivani. The truth is that I think Ivani has done more in our community to address these issues than anyone. And we're very fortunate to have her on our panel. More so, we're very fortunate to have Ivani in our community. Take advantage of this opportunity on March 21st and go down to New Vista High School, 6:30 to 8:30, to hear more from Ivani Dilger. And I've tried many times. I had the opportunity to sit in on a Natural Highs class many years ago, and I've tried to capture the experience in explaining it to people. I have done a so-so job. So we're lucky tonight because we actually have a high school student who has been brave to join us on our panel, who's involved with the Natural Highs program, and we're going to hear from him. His name is River. He's a sophomore at New Vista High School, and he's a member of the Natural Highs Action Group and a peer mentor for drug and alcohol prevention, education, and awareness. And so it's my pleasure to introduce River.
Thank you very much, John. First of all, I'd like to thank Lee and Linda for very humbling neuroscience and the statistics on youth use from you, Linda. That really puts a lot into perspective. So I'd like to thank you, first of all. My name is River. I'm 16 years old. I'm a sophomore at New Vista High School. And with that in mind, I believe I can bring a completely different perspective, kind of a first-person perspective of how this has affected youth. I'm a peer mentor and part of the Natural Highs Action Group, so I help run Natural Highs in a sense, and the program's really unique in its way that it educates kids without just saying, don't do this, don't do that. So I'm really lucky to have the education and the education you guys provided as well. I can say firsthand I've been associated with the marijuana culture, and I've seen the change from before and after medical marijuana dispensaries opened up in Boulder. And first of all, I can say it's a huge change. It's quite the rapid and huge change that you wouldn't really expect. I have a history, or I used to smoke weed, and I learned about it a lot in the Natural Highs program, and I have now been sober for quite a few months. So this is a really good opportunity for me to kind of reflect on what I've seen and what I've experienced in the Boulder community. First of all, there's two very controversial things that aren't understood when it comes to weed. First of all, as you were stating, Linda, the people don't know the difference between medical and street marijuana. They think there is a huge difference. And honestly, the only difference that I see between medical marijuana and street marijuana, medical is crazy more potent. Like 4 to 5 times as potent as marijuana you could just grow by yourself. And so it's not safer it's intended to be used for medical purposes, therefore being safer for the person using it, but it's not safer as a substance itself. It's the same exact thing as street weed, if not more potent. And then, as you were stating, Avani, the difference between psychological and physical addiction, and I can say there is no difference. If you are psychologically addicted to something, it shows up physically in your brain. So there's no difference between those two. And those are just two very common misconceptions that I've experienced and seen when people talk about weed in general. I've seen both sides of the spectrum as far as my opinion on medical marijuana. I have a very, very good friend who has multiple sclerosis, and he uses it just not to puke in the morning and get up from his bed without pain. So I've seen that crazy good side, that therapeutic, like that's what it was legalized for partially as a medical substance, and I've seen that firsthand and appreciate the use as that. And I've also seen just teen use in the past year. That's all I've been noticing, really. The teen use has just skyrocketed. Like, availability is the number one thing that's just gone through the roof with marijuana. Like, before, there was a dispensary every other block in Boulder. To be a teen and to get marijuana, you'd have to go and like find someone who deals it or grows it, which is not exactly the easiest process. Then you'd have to go like contact them, get it somehow, and it's obviously a very illegal thing to do. Like the entire process of doing so is very, very sketchy, and you wouldn't be able to just do it without sneaking by or being somewhat sneaky about it. But as far as now that there is dispensaries like so many dispensaries in Boulder and other cities nearby. All you have to do really is phone a friend or find someone on the road, on the street that has their green card. Maybe tip them $5 and they'll go and get you whatever amount of weed you want. And it's 5 times as strong and at least double as cheap. So just in those two aspects, if you want to smoke weed, first of all, you can get it 5 times as strong and half as cheap as you would otherwise. And aside from those 2 points, it's just so more available that you can go and find it in like 10 minutes just by calling anybody that you know with a green card or anyone that knows someone with a green card. It's just like, it's really easy to do nowadays, which is kind of an issue because you don't really need to go out of your way to smoke at all. Sometimes it comes towards you. A lot more often, from what I hear, the younger and younger kids are being exposed to it just because its prevalence and availability. And as you were stating, Lee, the younger you do it, that's when you're, like, I think you said 10 years old was when you have the most neurons. So 10 and on, that's when your brain's developing and choosing the pathways to keep the most. That's when it's the most active and most plastic. So, like, the younger you are exposed to smoking weed, the more effect it will have later in life, which is a really scary thing to think about. Because I've seen kids as young as like 8 and 9 smoking weed, like almost daily, which is ridiculous in my opinion, and I think most people's opinions. But yeah, this is a really good issue to talk about just because I do have a strong opinion on both sides of it, and it's really good to hone in on, aside from the medical purposes for it, the legalization of medical marijuana has affected a lot more than just medical use, a lot more. And I think that is kind of overlooked largely, and it's definitely something that should be addressed because it's only been legal for like a year, 2 years, not too long at all. And if this much has gone down in that short amount of time, I don't even want to like look into the future of if weed becomes 100% legal, because no one thinks it's dangerous at all if it's as prevalent as it is. If every other person can go to their doctor's office and say they have insomnia and get their red card, it's not really viewed as a drug, which is concerning because it is a drug, and it's a drug that stays in your body longer than any other drug. So most people have no clue about any of that, and they think it's just a fine and dandy thing to do. And yeah, I think that's a really good thing to address, just the use other than medical and how that's affected, especially teen culture. So thank you for having me.
Appreciate it, River. Thanks so much for your input. Now's your opportunity to get involved, audience. We have questions from our live audience. We're also looking for questions from our home audience. If you're watching at home, you simply have to go to boulderpsychologicalservices.com, click on the Submit Questions button, and your questions will arrive here. You still have a few minutes to do that, so if you haven't already, please feel free to do so. I'm going to ask the panel our first question, which is from our live audience. If use has increased 30% in Boulder, and we are seeing discipline issues at our high schools skyrocket, why are there not more parents here, and is there a movement to get this message out? If this is such a big concern, why aren't more parents concerned, and what, if anything, are parents in the community doing about it?
It was interesting about, when was the invitation to In Lions? About a year ago? We were invited to present Natural Highs and on medical marijuana in Lions, and I was so impressed that the town of Lyons, people had gotten together and really rallied with this issue, and were trying to educate each other about it. And I haven't seen this situation in Boulder at all, and I felt jealous, that this small town they're getting their act together, and we are just kind of asleep in Boulder. So. We have a lot of conversations in high schools, and we invite parents, and we often hear from parents that they're shocked and that they didn't know, that medical marijuana is the same marijuana as street marijuana, basically, and very basic things like that. So we're trying to educate parents in the high schools, but I'm also really having that question: why are people in Boulder not getting involved?
Yeah, I'd like to address that in one way. The ignorance about the substance is so pervasive. I went to a meeting of the Colorado Psychiatric Society in May, and the topic of marijuana was our topic to discuss. At that time, a poll was taken prior to the meeting, and psychiatrists all over the state of Colorado were polled as to whether they thought that marijuana had any place in the treatment of psychiatric symptoms. It was amazing to me that 60% of the psychiatrists felt like that there were times and places where marijuana had its place in treating anxiety, depression, various other psychiatric mood states. Now, there is not one piece of data that documents any efficacy for the use of marijuana for psychiatric purposes. Now, the fact that most people that get their card might get them for various reasons that have a psychiatric sort of nature. For example, anxiety is one of the higher sort of comments that people will make, is why I need the marijuana. And yet, probably what's happening is something that's more akin to just disengaging from emotions and disengaging from anxiety than anything that would merit an actual treatment of anxiety. In fact, marijuana can cause anxiety. So I think the ignorance about it is so profound that it actually is the way I would answer the question. Why are so many people ignorant about it? And one of the other elements of this is the controversies that exist about whether to make this a criminal offense or to legalize it. It's such a huge social, cultural kind of question. And it bleeds into the question as to whether or not, how do you handle the subject of marijuana? I'll stop there.
I think I'd like to return the question. I have often wondered why, when you look at these statistics and how they keep rising over the years, why it isn't being addressed more, why more parents aren't coming forth and rallying against it. One interesting statistic I did run across that I will throw out is the National Institute of Mental Health, NIMA, did a study a few years ago on weed use throughout cities in the nation. And they did it proportionately so that they could compare large cities and small cities, and they compared different sizes in different socioeconomic cities. And the interesting thing is that Boulder came out second for weed use, only behind Boston. So it was second in the nation for weed use. And the initial reaction in Boulder, actually, among many professionals in the mental health arena and also the medical, the reaction was, well, duh. I mean, we've got CU here, arguably the biggest party school in the nation some years. Well, here was the interesting piece to that study, though. This only included people that were 25 years old and older. So when you think about, we're second in the nation for weed use of people 25 years and older, it gives one pause to say, why aren't parents coming forth more? So I'll stop there.
I'd like to address this from the point of view of a high school kid. I agree with you completely, Lee, that there's a ridiculous amount of ignorance regarded with marijuana. I'd say 100% of the kids I ask or have discussed about weed with, they have no clue what it does in your brain at all. And they may or may not have knowledge of what other drugs do, but they have absolutely no idea what weed does. They say, well, it chills you out, man, or it helps with sleep, or makes me hungry, but they have no idea what's actually happening in their brain. And along with just the initial effects of smoking it, people are even more clueless about the side effects of weed. And I can say from a personal standpoint, I've seen relatives have psychotic symptoms from smoking weed, just weed alone. And people say, no, like, weed can't make you psychotic. It's just weed, like. But honestly, that's probably the scariest thing I've had to deal with my relatives, just because they don't know what the cause of it is, and they don't even connect that maybe their daily weed use is associated with their schizophrenic symptoms. Like, they don't connect the two dots because that's just not a well-known fact, that it may provoke psychotic symptoms. And just like as Ivani was saying, it does take a month or maybe a bit longer than a month to get completely out of your system. And so you don't hit that rebound effect for a month after. That's why you don't get symptoms of not being able to sleep or not being hungry or being anxious after you quit, because it's a month away that you get those negative symptoms. So people associate that with, oh, there is no side effects with weed. There's no detrimental come down from weed. It's a safe way to get high. That's the common thing that people say about it, and they can't support it and won't support it with facts because that's not true. But I don't see how something that's not true as that is can be so widely believed. And that's just kind of the point of view from high school kids, as well as, I'm sure, older people as well.
And keep in mind, those watching at home and here in our audience tonight, all of our programs that we do in partnership with BVSD and Channel 22 are archived on the BoulderPsychologicalServices.com website, as well as the BVSD.org website. And that's why we're doing this program tonight, because we feel like this information is important to educate the community. So know that if this is something that you want to share with your family, with others, you can do so by going to either of those two websites to look at this show and other shows that we've done in the past. I also want to let you know that our next program, our next Channel 22 presentation, will be on Monday, April 2nd. The topic is Parenting Through Divorce, and we'll be discussing utilizing effective, proven parent strategies that can make all the difference in minimizing the negative impact of divorce and help parents to learn how to help their children. So make a note of that, April 2nd, Parenting Through Divorce. We have another question from our audience. I'm thinking this one must go to Ivani. How many kids come to Natural Highs? And maybe give a sense of the history in terms of how many kids have gone through Natural Highs, if you could even guesstimate.
Thank you, Lena. I think we started about 6 years ago, and I think roughly until today, over 1,000 students have gone through Natural Highs in Boulder. And the program is co-created with teens such as River, and so it's constantly changing and evolving. And right now we have a drop-in program at September High School that is open for any high school age teen in Boulder. And every week we have 60 kids show up. Which is, challenging for us, but it's at an after-school, high-risk time, and so we are very happy that 60 kids come to us to learn about the effects of drugs and alcohol and to learn about healthy alternatives to that. So.
Mm-hmm. And am I correct, Ivani, that now, thanks to some grant funding and collaboration, that the Natural Highs program is a free program?
Yes, so right now it's free at New Vista High School, and it's free run at September School, but open to any high school age teen in Boulder. Yes.
Fantastic. And I can tell you from talking to teens that have been through the Natural Highs program, you really just have to get them there once, and then they get it. Avani is very skilled at developing an empowering, respectful environment for those teens, where they're educated in a very respectful way. And I just can't say enough about the program. If your adolescent has not gone to it, make sure that they do. I think we're out of time. Well, I want to thank our sponsors, the Boulder Counseling Cooperative, the Boulder County Healthy Youth Alliance, the Boulder Public Library Foundation, Boulder Valley School District, Centennial Peaks Hospital, the Parent Engagement Network, the CAMRA, and the Hope Coalition. Without their support, these programs would not be possible. I also want to thank our panelists for their time tonight, and our live audience for being here, and our audience at home. Thank you for watching the program. And of course, our partners, BVSD and Channel 22. You can find out more about all of the BPS community events, as well as viewing previous aired programs, by visiting boulderpsychologicalservices.com. We appreciate you being here. Thank you, and we'll see you next time.